I was a medical student in 2011, and every medical student in their third year does rotations through different specialties: psychiatry, surgery, OBGYN. So during my OBGYN rotation, I was on the gynecologic surgery part of that rotation for about 3 or 4 weeks. And I would come in to work and be assigned a certain number of cases, maybe 4 to 6 cases, surgical cases per day, and I would be with the surgery team for that surgery. And the process would be that before surgery, I would go in and introduce myself to the woman who was having surgery and say, I was instructed to say something sort of somewhat vague, like, "I'm Shawn, I'm the medical student on the team. I just wanted to meet you and say hi." Then the woman would get wheeled into surgery and be put under anesthesia. And once the patient was asleep, I was instructed by either the resident or the attending physician on the case to perform a pelvic exam for my own education, sort of a practice pelvic exam, because the musculature is very relaxed. It's an effective way to do a pelvic exam. And I did this for 4 to 6 times a day, 6 days a week for 3 to 4 weeks.
So easily 100 students, or 100 patients. Easily that was 100 patients.
I did, yeah.
And then how many students were in your class, or how many students were practicing in the same way?
Yeah, about 60 students per class, and it's a different class every year.
So that's a lot of patients.
I knew it was wrong from the start. So I knew that this was not an ethical way to practice or even a moral way to practice. But there's also a very rigid hierarchy within medicine and a medical training. And as a medical student, you're at the bottom of that hierarchy. And there can be severe consequences to going against that. I did as I was told due to the hierarchy of medicine, but also, frankly, because of my own lack of courage at that time.